Good evening, everyone. I'm Dr. Carl Tyler, President of the AADMD. I'm proud to welcome you tonight to our virtual Grand Rounds webinar series led by our AADMD students. For those of you who don't know, AADMD was founded in 2002, and we are an organization of interdisciplinary health professionals. We are committed to improving the quality of healthcare for people with intellectual and developmental disabilities, IDD. And we do this through our three pillars. Number one, education, which you're seeing tonight with this webinar, and at our annual conference, which will be May 5th through 7th in Denver, Colorado. Our second pillar is advocacy, which we do hand in hand with people with IDD. And our third is membership, which you should know students join for free and can access our new members only app. In fact, after tonight's VGR, you can connect with our members and rewatch this webinar on our new membership app. Just go to the link displayed on the screen and create your profile. Thanks for joining us, and I'll hand it over to our student moderator, Rachel Bockel. Good luck and take it away, Rachel.
Hi, everyone. Welcome to Virtual Grand Rounds. My name is Rachel Bockel. I'm a third-year medical student at Geisenberg Commonwealth School of Medicine in Pennsylvania, and this year's American Academy of Developmental Medicine and Dentistry Virtual Grand Rounds chair. To start, I just want to say if you have any questions throughout the presentation, please write them in the Q&A box on the bottom bar, and we'll go over any questions at the end. And then I'd like to introduce our moderator for tonight, Dr. Alan Wong. He has taught a postdoctoral general dentistry for 30 years in advanced education and general dentistry programs, and is the director of Pacific Hospital Dentistry Program and the director of Highland Hospital Restorative Implant Program. He has lectured nationally and internationally in the areas of special care dentistry, rotary, endodontics, implant restorations, and minimally invasive dentistry. He is an active with Special Olympics Special Smiles program as one of the two global clinical advisors, president-elect, American Academy of Developmental Medicine and Dentistry, and Special Care Dentistry Association, an immediate past president of the National Caries Management by Risk Assessment Coalition. Currently professor at the University of Pacific Arthur A. Dugani School of Dentistry in the Department of Diagnostic Sciences, as well as private practice in San Francisco. He is a member of the ADA, CDA, and San Francisco Dental Society. So thank you, Alan. Next, we have Justin Steinberg, a speaker for tonight. He is a research assistant at the Stanford Center for Biomedical Ethics on the Autism Spectrum with visual impairment called motor nystagmus. Justin graduated from Gunn High School in 2008 with honors and went onto Foothill College, completed an associate's degree in special education, also with honors, and then transferred to San Francisco State University, where he completed his bachelor's degree in history cum laude. He then completed a master's degree in special education with an emphasis in visual impairments from San Francisco State University and graduated with the Graduate Student Award for Distinguished Achievement. Justin is also a Special Olympics Northern California athlete, board member, coach, and athlete leader. Justin currently competes in unified flag football, floor hockey, basketball, track and field, and swimming. In 2019, Justin was inducted into the San Jose Sports Hall of Fame as the Special Olympics Athlete of the Year, and in 2020. In his free time, Justin enjoys hanging out with friends, playing video games, participating in sports, and being involved in music. Next, we have Gabby Segal. She is a fourth-year medical student at the University of Texas Medical Branch. She is currently applying to be a pediatric geneticist and will be starting her residency in the summer of 2023. Gabby has a passion for community engagement and medical education in the IDD field and has done work to further the inclusion of the IDD community into the educational experience in Galveston, Texas. Lastly, we have David Fray. I think he might be joining us later tonight. Dr. David Fray is a graduate from Houston Baptist University from UTSD Houston in 1979 and received his MBA with an emphasis in healthcare administration from Oklahoma City University in 1997. He completed a one-year geriatric long-term care administrator preceptorship at the Arkansas Health Center and has completed postgraduate training in developmental dentistry. Dr. Fray owned his private practice for 15 years and has served 24 years as a public health administrator and educator. He served for 5 years as the director of Arkansas Health Center and the Developmental Disability Services Division for the state of Arkansas, followed by 14 years in the Hawaii Department of Health as chief of the Division of Developmental Disabilities and the hospital and community dentistry programs. He is board certified in long-term care, is a licensed long-term care administrator, and holds a master's level certified health emergency planner certification. Since 2015, he has been professor in the Department of General Practice and Dental Public Health at the University of Texas Health Science Center School of Dentistry at Houston. He and his wife, Judy, are the proud parents of 2 adult children and grandparents to 4 grandchildren. So those are our speakers for tonight. I'm really excited for tonight's talk, and I'll hand it over to Alan.
Thank you so very much, Rachel. It's a pleasure to be with us tonight, and this topic is near and dear to a lot of our hearts. And I see so many faces and names on the participants. Thank you for joining us tonight. And as Rachel had mentioned, if you have any questions, feel free to put them in the question and answer session. But just to sort of give you a pulse of where we are in terms of National Oral Health Curriculum, I was asked sort of to share with you sort of the story behind it a little bit, and our journey in a way towards health equity. And I'm honored to have Justin and join us. He's a punster when he's not a self-advocate, but we have also Gabby, who's from her perspective as a medical student, can chime in as well. And then Dr. Fray will join us as well. So how did this all begin? Well, we know that the population is marginalized. We know that a lot of times it's very difficult to get care. And there's a lot of myths out there. The myth that patients with IDD are very challenging to work with, that you need special equipment or you need a special building or a facility to work with. And that's just not true. It's just not true at all. And we believe strongly at AADMD that if we look a little with our eyes a little wider and listen a little longer, there are a lot of ways that we can overcome a lot of these obstacles and barriers and take care of the population in an equitable manner. So about 7 years ago, AADMD embarked on the idea and the concept of, can developmental medicine be taught in medical schools? So we started out with that as a premise. And so we got some grant funding and created the National Curriculum Initiative for Developmental Medicine. This was about 6 years ago, headed by Matt Holder and Priya Chandan. And they've done a remarkable job in terms of providing materials to develop curriculum at different medical schools. And originally they were targeting 7 to 9 medical schools in terms of recruiting them to see if the schools would even participate, and 2, if the attitudes of medical students, if they would be willing to learn about developmental medicine. So after 5 years of hard work, actually 6 years now, they've recruited over 18 medical schools that have participated not only a little bit, but a lot of it. And they're finding out that medical students are very, very engaged and very, very creative. So the information that they've garnered will be published in this next year. But through this revelation, we found that a lot of things that in medical school actually relates to all healthcare fields as well, whether it be oral health or nursing or PT, OT, whatever. And we decided to embark on sharing the wealth of information by creating curriculum. And the project we embarked, our next phase 2 is called the Niche Project, the National Inclusive Curriculum for Health Equity. And so in it, we decided oral dentistry would be, or oral health would be our next target. So my colleague, Dr. Fray at the University of Texas, myself at University of the Pacific in San Francisco, and Dr. Mark Wolf at University of Pennsylvania, or Penn Dental rather, decided that we would go after a grant and see if we can pool our resources in creating a curriculum project that we can share with all other dental schools throughout the country. And so this topic, for us, by us, it really gears towards the heart of those with IDD. And in our slogan, in terms of one voice for inclusive health, that's what AADMD embarked to do. So this is a collaboration project, if you will, that we went through the country to find out all the different schools that are teaching disability and IDD care. And we went and sought out the best of the best and asked them, would you participate and sort of share with us your best information? And everyone said yes. Everyone, and we're delighted to see, we're somewhere 70 to 80 authors are contributing, and we're delighted. We have lots of talents in different areas as well. So let's go ahead and talk about this a little bit more. So first of all, we decided that what's in the name, name wrote by any other name, and that goes there. It's like we wanted an oral health curriculum, and if you were just to write IDD curriculum, some people wouldn't understand what that meant. So we're toying with the idea of, is it an oral health disability curriculum? We're still in the early parts of what the final name is going to be, but bottom line is we wanted to create a curriculum, and at the same time, the American Dental Association changed their code of ethics to add the word disability into their things that they will not discriminate, which created a Commission on Dental Accreditation standard, meaning that all dental schools must have graduated dental students that have both the didactic and the clinical experience of taking care of people with disabilities. So this came at a right time to help elevate this concern and this curriculum project itself. So what's in the name? We're still debating that. So we decided as a working title to call it a National Oral Health Curriculum, and whether we put IDD or disability curriculum, it's pretty much the same concept and idea. So this kind of fosters using the information from the medical education that we've learned, as well as adding a specific focus in oral health, whether it's for dentists or dental assistants or dental hygienists. We feel that it's important for the whole thing to happen. We wanted to make it not like a traditional textbook. We wanted to make it like a resource or a toolkit that can be used for the student. It can be used for the teacher or the facilitator, and it could be used as a resource for anyone. So this is meant to be shared for anyone who wants to learn more about things. So one of the myths is that, if there was an oral health curriculum, would people teach it? And then the question is, who would teach it? Because we don't have enough people with experience to teach it. And then will we find patients to treat and take care of? And all those are myths and things that we found out that just aren't true. And so we're trying to make this curriculum so it can help facilitate teachers to teach this topic. And so we want to give them a ready to use topic that makes sense and fun and interactive. So with that, we wanted to have not only the links to things, we wanted to have self-advocates involved with their vignettes and their discussion feedbacks. We wanted to incorporate dental students and medical students in the information gathering and updating everything in that regards, and helping us to create even things like this, virtual grand rounds on topics that were relevant, because we know that the learner nowadays does not want to sit in front and listen to an old person like me talking to them. They want to hear from other folks like Justin and Rachel and, and those folks. So anyway, so it's meant to be online. It's meant to be user-friendly, and we're not charging any of the dental schools anything for it. So we want to make it as easy to be used. So it's online. There'll be downloadable chapters, and the chapters will have accompanying PowerPoints to them for teaching resources, and they will have testing tools as well. We call case-based learning and facilitative guides, so that we can really interact as well. There are basically 4 sections in our curriculum project, and it's meant to be sort of pick and choose, because right now in education, all the hours are taken up for curriculum, if you will. So in order to fit something in, something has to be cut out. So we want to make that each section would have topics that would be easily bite-sized, if you will. And for those who are my age, there's a Cliff Note version or TED Talk version that we can insert in certain areas that people would want to embrace and put it in. So it wouldn't be like an hour lecture, it'd be like 10, 15-minute lectures that can be substituted and used accordingly and interactively. So in the first section, we would have the embracing the challenge of health disparity, or really, why should we care? And bring attention to our colleagues that there is a disparity in many ways. And we'll go through that a little bit. The second part is really the assessment, the dental treatment, health promotion, and how we modify what we teach, because there are some modifications that are necessary and some things that can be really beneficial. The third section is improving health outcomes with collaborative care. We know that the teeth and the gums and the mouth don't just stay there, they're interconnected with the whole body. So we want to talk about how can we improve overall health through oral health. And lastly, the fourth section, which will be ever growing, is the educational resources. And that's the areas where we have examples of rotations, examples of case-based studies, OSCEs, which are observational kind of controlled groups, and a lot of evaluation tools, so that we have everything ready to use for any dental school that needs to have this. Because I told you before, there's a new educational standard, and students graduating must be proficient in those areas. So the 3 major editors will be David Fray from Texas, Mark Wolf from Penn Dental, and myself. And then we have section leaders, some of you who may know already, who are leading those 4 different sections. And Steve Perlman, Miriam Robbins at Penn Dental, Deanne Wells, Ben Warner, Elizabeth Thompson. And then on section 4 would be Paul Subar, Deanne Wells as well. And we have about 70 or 80 and growing authors contributing to this project. And what's fantastic is it's going to be health literate, and it's going to be made very user-friendly with illustrations with our friend Rick Gadati, whom many of you do know. So I'm not going to go through these in detail, so don't worry, I'm not going to read each line, but basically everyone is assigned things. Different color codes mean different process in the development. Green is almost done. Red is we're not there yet. Yellow is in process, but hopefully we'll have this project done in hopefully about a year and a few months. So section 1, section 3, we have various people that are with us and involved. We have a timeline with checkpoints. Right now we are in a phase between draft 1 and draft 2. Hopefully by March we'll have draft 2 ready, and then we'll be doing editing in the summer, and adding illustrations and changing the topics into lecture PowerPoints for the presenters. So it'll look something like this. It'll look and feel like this. Very user-friendly, very engaged. Our own Courtney Fray did our design. And this far left side that looks like a pencil basically resembles the different components of education. We have the person, the educator, and the third part that I'm missing right offhand. But anyway, it comes together to a point the student, right? Thank you. And it comes together, and as in academia is, we have things written down, and that sort of illustrates that of a scholarly activity. And so this topic or sample chapter would be diagnostic overshadowing, a primer, and it'd be very engaging and very, very easy to look at and very easy to read and follow, and take home points are that the introduction, the background, what it really means in terms of outcomes, recommendations, how this affects the patient. These are all things that are meant to be engaging and things that are memorable, key points, and discussion questions for the students, and resources and references. And some of these will link on to videos and YouTubes and whatnot, because that's what it should be. Curriculum should be fun. It should be engaging. It should be, you want to learn more. So that's what we're trying to make this. We're trying to make it very attractive and workable. So that chapter is then made into a PowerPoint for lecturing. And through the generous funding of Delta Dental Foundation, they've allowed us to be able to do all this. No authors get paid for any of this. Some of the editors get a little bit of offset so that they can use for their time. It's called competitive release time, so we can work on this during our working hours. So I'm very proud to say that it's very cost effective. So the sample PowerPoint, and then we have some case-based scenarios that really drive the point home. So and that way it prepares the learner so that they can be in the clinic and understand the differences, because teeth are teeth, but in different circumstances of the person. So this is a case-based scenario as a sample. And then we'll have different links to online resources, to some of the virtual grand rounds like the one we have tonight, to some of the self-advocate vignettes and testimonials, to some of the resources, websites and educational videos. There are so many out there. We're not here to reinvent the wheel, but we are here to help point to the ones that are really, really good. And then links to references and sample predoctoral rotations, in case some dental schools have not thought of how they're going to work this out. So I wanted to make this kind of informal. So by now, has Dr. Fray joined us? Ah, yes, he has. Okay, so welcome, Dr. Fray.
Sorry about that.
That's okay.
Can you see me?
I can see you now. I started to give a brief history, and this kind of brainchild really was kind of festered in Dr. Fray's mind for many, many years. And so Dr. Fray, myself, and Dr. Will sort of pushed it to this degree. Did you want to add anything to what I said so far before we engage Justin?
No, I thought it was great, and I'd love to hear input from self-advocate, from Justin, and from Gabby, a student. I think what makes this curriculum unique is that it's a dynamic, organic, changing curriculum, and it includes the perspective of individuals with intellectual disability. It includes the perspective of families, includes perspective of students. So I think that's a very different approach. But that's really all I had to say. I thought you did a great job on the overview.
Okay.
I'm going to be joining my phone in a little bit, so you'll see me double on this thing, and that'll let me get in my car and drive.
Oh. All right. So I see a lot of comments on the slide, and I appreciate them all, and we'll record and keep track of a lot of them. So let's go to Justin first. Justin, this is the first time you've kind of seen the backdrop of everything and how we're trying to present it. From your perspective, what are your thoughts of this?
I think it actually looks really, really good. I really like how there's going to be an emphasis on the perspectives of patients with disabilities, and in particular IDD. That's intellectual and developmental disabilities, for those who aren't familiar with the acronym. Yeah, I think the engagement with the discussion questions and the case-based scenarios, that's a really good way to approach this. So I think all in all, I have to give that 2 thumbs up.
You're too kind. Gabby, you're in medical school, so a lot of thought was originally was medical students don't want to learn this; they want to learn other things. And what do you and your colleagues think about curriculum?
Yeah. So as far as medical students go, in terms of like oral health curriculum, we don't get anything basically, and we joke about between ourselves about like it's such an important system and can impact what we will be learning about throughout medical school. So there's definitely an interest in getting more insight into oral health and how to encourage our patients more to take care of their teeth, take care of their mouth, and regularly see their dentists. And then in terms of like IDD care, in my experience so far, implementing curricular components into medical school, we've been getting feedback from all of the students about how they feel about the topics, and everybody has said how they want more, they want to learn from patients' experiences, from people with IDD, and a lot of them have that, like you were saying before, the myth that it is harder, and there's a lot of anxiety in initially interacting with patients with IDD, and having some substantial discussion about it is not only important, but it's very of interest to us.
Thank you, Gabby. In some schools, they have what's called standardized patients. Rachel, I'm going to bring you up on, have you turn your camera on there. What's your experience with IDD education in medical school? Any?
Yeah, so my school, this was something we were like a little bit involved in, is we had a couple conversations with people who came in and they had disabilities themselves, and they would like speak to us and their experience in the healthcare field and stuff. And I found it really valuable to kind of learn from their perspective what it's like navigating the healthcare field. And in terms of standardized patients, we don't really get much experience outside of that. So we don't really get patients with developmental disabilities or things like that. Like I know one year when Doug Wells was with us, we did have that, and that was really great, but it's kind of hard you have to keep advocating for things like that.
Justin actually has been a very good self-advocate, and he's also helped us as a standardized patient in a sense. He's come in and he's lectured to our students and our residents about things that are frightening, things are helpful. Justin, what do you think what do you think when you're teaching my students and my residents?
They're very receptive, but I can also tell like there's not a whole lot of experience, unfortunately, for some of them. And I think bringing standardized patients with IDD to speak and allow them to practice those important skills is definitely something that needs to be done. As an example, I remember when I did that photo shoot with Rick last year, I actually also participated in a small group discussion with one of the dental students, and I talked about how really important it is to be mindful of the fact that some patients with IDD, when they go to the dentist, they have a strong gag reflex. I'm one of them. So try to find a way to help address that, especially when it comes to x-rays. I have a dental hygienist who really understands that, and they've used like a special numbing rinse before taking an x-ray. And they also make sure that the thing I have to bite down on isn't too big. I still gag, but it's a lot less stress that way. So I think, yeah, being open to finding ways to accommodate the gag reflex and communicating and asking what they can do to help with that is definitely something that needs to be done.
Yeah, Justin, I gag also, so you're in good hands. We all have that fear as well. In terms of teaching, who teaches what, do you find difficulty in finding expertise in your medical schools, either Gabby or Rachel, in terms of who has the experience teaching this?
At first, I definitely had some challenges, and with my limited experience, I was able to step up and teach a little bit. But over the 4 years that I've been here, over time, I've been able to get into those smaller clinics that were harder to find, those clinics that were specialty for patients with disabilities, and finding those physicians were, once I was connected with them, they were there was like no hesitation in joining the effort. So I think finding people can be a challenge, especially at a mid-sized to smaller institution. But searching for the people who have those kinds of clinics, I guess, was the way in.
Well, I'm very, very glad that AADMD has the student resident chapters, because you're the leadership that's going to help drive this next evolution of learning. I think that sometimes we don't teach things because we're afraid to, we don't know how to. And hopefully in medical school and dental school, we'll be giving some tools that they can utilize. And hopefully the students in medical and dental, nursing, whatever, can encourage their faculty to learn a little bit more, to do a little bit more, and not be afraid. Utilize resources like Justin. There are so many self-advocates willing to help in the educational process. I'm sort of stunned here. I'm looking at the attendee participant list, and I see about 12 of my contributing authors that can probably add to different things here. But just that's sort of another dedication. I see some of my board members from AADMD here, of the support and the love and devotion that we want to add to this. We often, I used to call this sort of the stone soup. There was this old adage about this very, very poor soldier back in wartime and had no money. He only had this pot, and he was hungry, so he put this pot and put some water and put a stone in the pot and made a fire and was boiling it. And people came up to him and said, "What are you making?" He says, "I'm making stone soup." And the person says, "Well, how's it taste?" He says, "It tastes delicious." He says, "Well, can I try some?" He says, "You can try some, but you have to put something into it." And he says, "All I got is these carrots." And he says, "Well, throw them in." So he throws in the carrots, and another person walks by and says, "What are you making?" And he goes, "Making stone soup." And he says, "Is it good?" He says, "Yeah, it's good." He says, "Oh, yeah, but to have any, you got to put something in." He says, "I got these onions." Well, the day goes on, and next thing you know, you have this very, very rich broth, very flavorful. And that's what this project's all about. It's a collaboration project of not just dentists and oral health care providers, but we're hoping to add those different elements of physical therapy, occupational therapy, behaviorists, and different disciplines in it to make it richer and more fulfilling. So it's not just about teeth anymore, it's about the person. And same thing that we're trying to do in medical education, we're trying to add oral health into that curriculum as well, because they're interconnected, just like our name is. It's Academy of Developmental Medicine and Dentistry, not or dentistry. So we want to teach the medical students what's relevant to see what they need to see in a different light, because often you're given a tongue depressor and you see from the lips to the tonsils, but you don't see anything in between. So we're going to try to slow you down and show you what you need to see in between. Dr. Tyler, you're over at Cincinnati. Do you have any comments in terms of your colleagues and your colleagues' familiarity with people in teaching IDD at all?
So just as a correction, I'm at Cleveland Clinic, not
sorry.
Cincinnati. That's okay. Both begin with a C and both are in Ohio.
That's right.
So I teach at the Cleveland Clinic's Family Medicine Residency, and we actually do a lot of teaching. And I think it begins with, at least in primary care, with having a healthy, enriched patient panel of adults, in our case, adults and children, but I primarily work with adults with developmental disabilities. So, I mean, I think, you know, we can't just have extramural experiences where people go outside their home, as it were, or base clinic to learn about developmental disabilities healthcare. They need to be part of our community and our clinic community. So I think that's a pivotal point. We also have a lot of close supervision so that experiences are positive for patients and for the learner. And so when we have new patients with developmental disabilities joining our practice, typically the resident and I will meet the patient and support persons or family together. And then we do what's called a shared care model, where we alternate between me and the resident physician so that they have adequate supervision and support. And they have the benefit of having two people whom they get to know well, two physicians. And then a third thing is we have a lot of enhancements with our electronic health record and with our clinical kind of flows. And so an example of that would be when a new patient with developmental disabilities comes into our practice, the day prior, our nurse or medical assistant will call the patient and family or caregiver and ask a series of questions about essentially how can we make this first appointment successful. What are what is the name the person likes to be called? What are favorite topics that they like to talk about? What are things that trigger anxiety? What are strategies to diminish anxiety? So we have a pre-visit telephone questionnaire that kind of sets up that first appointment for success. And I think those, clinical strategies and infrastructures and workflows and enhancements just make the experience more likely to be positive for the patient, most importantly, and for the learner. And then that makes them more likely to want to and be attracted to invite people with disabilities into their practices once they graduate. So I'll hush up for now.
No, those are really good points, Carl. Justin, I'm going to go to you in just a second. The pandemic, unfortunately, did some really bad things, but one thing it did open us up to is technology. And we utilized a little bit of technology, Justin, as you recall, in terms of we couldn't be with each other. So we did some exercises where we had some informational things. What are your thoughts about using video conferencing? Or
it has its pros and cons. Its pros are like the use of video conferencing tools can actually help patients with disabilities who also have transportation issues. But one of the biggest drawbacks is if you have a spotty internet connection and the internet goes out, you're not going to be able to use that tool. Also, besides that, though, some patients just don't really know how to use that technology properly. So in that case, they may not have a choice, but they may have to go in to a clinic at some point and just have to wear a mask and stuff. But yeah, I think the video technology, as useful as it is, also it's not useful for everything related to healthcare. Like I've used it for mental health, and it was quite useful. But for like a physical or something, I don't know how effective that's going to be, because a lot of those things that you have to do, it's not really conducive to doing something over a video call, at least in my opinion.
Yeah, no, I agree. It's not the substitute, but it's an introduction, because a lot of clinicians have never worked with this population before. And it's nice to see your smiling face and without a mask on. And it seems less like it's a little more informal. Like Dr. Tyler was saying, that it gives us a chance to know you. You can hear our voice. You can see who we are. We can answer some questions so that when you come into the office, maybe you're a little more comfortable. And also you're comfortable at your own home as well. Let me answer some of these questions, and then I'll come back to our group here. Suzanne asks, how do you see different dental schools integrating the curriculum you have designed? Suzanne, it's really, you pick and choose whatever you think that you'd like to. The dental school might already have some great topics already, and they'll use it to supplement. It's not a mandatory, you must use everything, but it's like a library or resource, or back in the old days, like an encyclopedia. You go and pull out what you want to use and how you want to use it, and see what works for your school. And then Lauren says, is there a plan to offer similar training to dental providers that are currently practicing? Absolutely. We want to educate not only the new practitioners, we need to do a better job in doing continuing education for those who are currently practicing. And I think there's some hunger for that right there. Rachel, how did telehealth work in your area when you were having to go through things? Did you utilize it at all?
Yeah, telehealth, we definitely still use it nowadays too, but yeah, when COVID, first happened, it's, what we had to use. So I think it's a very valuable tool to have, because, it allows you to see let's say you have a special provider that's maybe an hour away that you need to see. You can just hop on a video call and talk to them, and not every visit requires a physical exam. So I think a physical exam is definitely important to get, yearly, or if you have something that requires that, but not everything requires that. So it opens up a lot of access to see a provider that you might have transportation barriers to get to, or things like that. And I think just it's a little bit less intimidating, maybe if you're fearful of the doctors, or have a certain barrier preventing you from going to the doctors. It's a little bit less intimidating to do it on telehealth. There is that technology barrier too, but I think there's definitely benefits to it for sure.
Right now, I don't know in your areas, but the wait time of getting into a dental office or even a medical office is very, very lengthy. And sometimes it's necessary to triage emergencies. And I think that's the one value that it allows, that you don't have to arrange for transportation and all that maybe we can triage it video wise, and then we can sort of expedite things that care. Gabby, how about in your area? Are you all utilizing telehealth at all?
Yeah, it was very useful, I think, for we have a behavioral developmental clinic that utilized it quite a bit, because they have massive wait times. They were able to be a little bit more efficient, and they were able to kind of mitigate those transportation barriers. We also had like a small kind of standardized patient workshop that we put on for third-year medical students here, and we were able, unfortunately, it was supposed to be in person, but we were able to use technology to keep everybody safe, and it still was able to kind of get the point across to the students. They all reflected that human connection in person is, you can't replace that, but with what we have, it's great.
Very good. I mean, it's a tool. It's not a replacement of anything, but it's certainly a tool out there that we hadn't really been looking at too much. I see one of my colleagues, my good friend all the way from Abu Dhabi's joined us. I don't know what time it is over there, but thank you for joining us. And we have people from all over the country. Let's see, I'm just trying to see what some questions are in the chat. So David, how is teaching your students? What's their response when you're teaching the curriculum? Dr. Fray is probably looking for his unmute button. Okay. All right. Justin, if you had a magic wand, okay, you had a magic wand and you can transform healthcare, what would you transform first?
That's a tough question. I would definitely try and address transportation barriers, just because, you know, some people really, myself included, we can't drive, and the public transportation system is, like here in Palo Alto, it's spotty at best. But I also do think like telehealth definitely still has its place. I'm not saying it's not useful. It's just it does have its limitations. Yeah, but I think addressing transportation barriers in some way would probably be a good place to start. Try and make dental offices or medical offices easier to get to, for so people don't have to rely on other people to give them a lift, like maybe within walking distance, for example, something like that. That's where I would start.
You know, when you talk about transportation, Justin, sometimes you get a bad rap because if you don't show up on time, then they think that, oh, this patient doesn't care or they missed their appointment. So sometimes you get that loaded on top of already a negative experience,
Yeah.
right?
Oh yeah, no, that also needs to be addressed. I think people in the doctor and medical, like dental offices, need to be trained in the fact that their patients with disabilities, they may struggle getting there on time, and if they are later, they end up having to miss the appointment because the transportation system is spotty. What they need to do is just kind of call and check in and see what's going on, and not blame the patient for not being able to get there. Ask what's holding, what's going on, and if it is up to me, medical and dental offices would be able to help with transportation if push comes to shove.
Yeah, I think us as health educators and health providers, we need to look at the root cause basically, because it's not, I know it's not all upon the patient's ability, and sometimes they're dependent on other things and care providing and whatnot. So yeah, thank you for reiterating that. Gabby, you're going to say something. I can see you're smiling and you're nodding. Anything you wanted to share with us?
I mean, when you said a magic wand, the first thing I thought of was like, universal healthcare and having, I feel like dental insurance especially is not as accessible to people as maybe medical is. I don't know why that the government considers these luxury bones, but I would just say that plus maybe some more integration within the community. So, getting to know the patients from the professional side. Yeah.
I agree. Often it's some more charity care or care that's just extractions and things that you wouldn't want for yourself. And we're trying to change that. And we need to do more in the prevention role, and there's a question that Orpheus had. With the resources that are available, will there be videotaped sessions with individuals like Justin sharing information from their perspectives, addressing specific topics? Absolutely. That's kind of the key to the whole thing, because no one tells a story better than our advocates and self-advocates. And so we're going to include them as a curriculum and link them on. There's some questions here about how can we, the mandatory requirement to address disability, including IDD, was a major force. How can we make that happen in other healthcare disciplines? Well, slowly and steadily, we're going to recruit more and more folks like in the nursing area and help develop niche projects in those areas. Hopefully, they've already got some great examples and PT and physical therapy as well. Agnes asked, how do you address a large number of patients that are nonverbal with severe behavior issues that need IV sedation? In Tennessee, we have over 300 patients on the waiting list. Agnes, my heart breaks for you. The key is, I don't have a magic wand to that, but I wish I did. But sometimes patients get overlooked thinking that they can't be treated. And really, a lot of them can be seen by behaviorists, and we could do the lower level things that can help arrest things like there's silver diamine fluoride in dentistry that we can stop decay from growing, but we need to do it at an earlier age, and we need to teach the physicians how to utilize this too, to stop the decay process, and then you have less patients on the waiting list, hopefully. And so no magic wand here, but I think a lot of it has to do with prevention and catching them early, and the thing we call the transition of life from a pediatric care to an adult care sort of thing. I think we've not done the best job we could, and hopefully we're going to teach our oral health educators and clinicians how to do a better job in doing that and prevent the teeth from getting any worse. 70 to 80% of the patients with IDD actually can be seen in a dental office and be treated with minor modifications. You don't have to buy special equipment or whatnot. Let me see what else do we have in the chat here. We have a few more minutes for any questions that people want to type in there. Thank you all for all your great chats here. Michelle says, I find students are much more engaged and eager in clinic as opposed to seminars. Absolutely. To me, when you touch the heart, you change the mind. And to do that, you have to have physical interaction. I think that's the beauty of Special Olympics and Special Smiles project or programs that we did in Healthy Athletes, that we were able to have people that have never worked in a population before come in, work, and come out saying, you know, that wasn't hard at all. That was pretty fun, actually. And when we change the minds, hopefully we sort of change the whole healthcare system itself. Let's see, Melissa saying absolutely prevention. Nikki, I like that. No human fits into a box or a book. That's true. Yeah. Anyway, so I think education has we've got some great things ahead of us. I'm looking forward to sharing this final project in the next year and a half. We're going to be presenting it at the ADEA, American Dental Educator Association, in March, to share with others and hopefully to inspire other dental schools to adopt this program. And it's one of those things that we think that a rising tide lifts all boats. We'd like all graduates to at least have a certain curriculum that they feel that's kind of standardized, and then we'll share it with other people as well. Justin, and any thoughts so far that popped in your head? I appreciate your input.
If there's a way this curriculum could also be taught to undergraduate students that are looking at going into medical or dental school, that would be really useful too. So they kind of start getting the skills necessary before they go on and pursue that degree, that advanced degree.
Justin, that's why you're on our board, man. Great idea. Really great idea. Thank you. And David, and then I'll come back to Rachel and Gabby. David, do you have anything to add? I want to be respectful of people's times.
He's having trouble connecting. I'm so sorry.
Okay. Final thoughts and comments. I'm going to go to Gabby. What are your thoughts in terms of the whole process?
Sounds like we're on the right track. Just really looking forward to seeing how this takes off and the ripple effect it will make on the community.
And Rachel, you've been a veteran. You've seen this for years and years, and this evolving and growing. What are your thoughts?
Yeah, I just want to say that having organizations like AADMD are so important in medical schools and dental schools. For me, like starting out as a first year, that's I was looking for an organization like this to kind of support my goals and support my interests. And so I'm so glad that, you know, we exist and that we, you know, are changing the curriculum. So it really starts with us.
Yeah, definitely. And like I said from the beginning, Gabby, Sophia, and Rachel, you are the leaders. You're gonna, you know, I wish that we had something like this back when I was younger and had hair, but we didn't. And I'm glad that you do so now. I'm going to turn this back to, is it Rachel? Are you taking this, or Sophia?
Yeah, so we have our next VGR coming up. We don't have an exact date set yet, but it's going to be kind of a continuation also on the curriculum and kind of changing the pictures that are seen of people with developmental disabilities. So it's going to be on this national inclusive curriculum for health and education with Dr. Priya. So we're really excited about that coming up, and we'll get all that information out for you.
Finally, I'd like to thank everyone for joining us tonight. The Helen Journal, helenjournal.org, has just come out. We're celebrating a couple of great things, and that is Black History Month, but we have a wonderful, wonderful article. And go check out the helenjournal.org. I think you're going to find it very, very inspiring. helenjournal.org. It's free, but it's got some really, got a great tribute for this month. Courtney, do you want to talk a little bit about Mighty Networks and Helen Journal at all? It's her masterpiece.
Absolutely. Sorry. Yeah, I'm kind of skipping all over the place. I didn't know. Oh, that's the wrong one. No, go back. But you can watch today's webinar on our Mighty Network, and it's our One Voice network. And so it's an app. It's also on the website. So you go to network.aadmd.org, join, be a member, watch webinars, look for IDD events, connect with other AADMD members. It's a great resource and a great way to stay connected between these amazing events.
Great. All right. Have a great night, everyone, or morning, wherever you are. And thank you for joining us again. And thank you, Rachel, Gabby, Justin. You really made it. David, thank you for joining. Sorry you're having problems, but have a great night, everyone. Thank you.
Thank